If you or someone in your house has tested positive for COVID-19, there is no need to worry or panic. In this difficult time, you are not alone. We are with you, and together we can help you return to good health. Doctors are currently advising patients with mild symptoms to home isolate for 10 days. If your doctor has advised you to self-isolate, kindly follow the instructions strictly. Before starting the process of home isolation, please consider the following points. A separate, well-ventilated room and a separate toilet should be available for COVID-19 patient at home. If not, please inform your doctor. A caregiver or an attendant should be available 24/7 for the care of the patient. Elderly patients aged more than 60 years and those with comorbid conditions such as hypertension, diabetes, heart diseases, chronic lung, liver or kidney disease, stroke, cerebrovascular disease, etc. shall only be allowed home isolation after proper evaluation by the treating physician. A certificate from the treating physician that the patient is stable and fit for home isolation is to be obtained. If anybody in your house is above 60 years of age, is pregnant, or has any severe medical condition like cancer, severe asthma, respiratory disorders, diabetes, hypertension, high blood pressure, cardiovascular disease, renal disease, etc., please shift them to another house until the patient recovers. In such situation, it is not safe to home quarantine a COVID-19 patient in your house, as it can be dangerous for those with serious health conditions. Check your oxygen level on the oximeter at least twice a day. Instructions for patients in home isolation. Download the Arogya Setu app on your mobile phone and enable notifications and location tracking on the app at all times. Wear a triple-layer medical mask at all times. Discard the mask after 8 hours of use after disinfecting it. The front of the mask should not be touched or handled during use. After use, discard the mask by using the appropriate technique. That is, do not touch the front, but instead untie it from behind. Disinfect it and wash your hands thoroughly with soap and water for at least 40 seconds, or use alcohol-based sanitizer after disposal of the mask in a closed dustbin. Avoid touching face, nose, and mouth. Kindly replace the mask if it becomes wet or visibly soiled. Before disposing a mask, disinfect it with 1% sodium hypochlorite solution. 1% sodium hypochlorite solution can easily be made at home using sodium hypochlorite bleach containing 3.5% chlorine or bleaching powder containing 70% chlorine. In order to make 1% sodium hypochlorite solution, mix 1 liter of sodium hypochlorite bleach in 2.5 liters of water or 7 grams of bleaching powder in 1 liter of water. The following should be kept in mind while using the solution. Always wear mask and gloves. This solution can be used for cleaning of doors or high contact surfaces like windows, doorknobs, chair, dining table, cupboards, etc. This solution should not be used to clean metallic surfaces like door handles, security locks, as it can lead to rusting. Other alcohol-based sanitizers should be used for disinfecting metal surfaces. This solution should never be sprayed directly onto the toilet surface. Spray it on a cloth or toilet brush and then use for cleaning the toilet. You should use only the dedicated toilet assigned to you. If your toilet has a lid, always close the lid before flushing. Keep all windows in your room open. Please, strictly remain inside your room for the entire duration of your home isolation. By moving around the house and accidentally touching surfaces like doors, windows and tables, you risk infecting other people in your house. Wash your hands often with soap and water for at least 40 seconds, or clean them with an alcohol-based sanitizer. Do not share personal items like utensils, towels, etc. with other family members. Frequently clean surfaces in your room like tabletops, doorknobs, handles, mobile phones, computers, remotes, etc. They are often touched. Clean them using the 1% hypochlorite solution or alcohol-based sanitizer. Strictly follow medication as prescribed by your doctor. Consult your doctor if you are taking regular medication for any other health condition. Avoid alcohol and quit smoking during isolation, since use of alcohol and smoking is more harmful for COVID patient. Take adequate rest and drink plenty of fluids like water, juice, tea, coffee, soup, etc. to maintain adequate hydration. Eat at least 3 low-carbohydrate, high-protein meals consisting of adequate vegetables and fruits. Remember, home isolation is physical distancing, not emotional distancing. Keep in touch with family members, relatives and friends over phone and video calls. Catch up on your favorite TV shows and movies, read books, listen to music. Instruction for caregiver or attendants. Download the Arogya Setu app on your mobile phone and enable location tracking and notifications on the app at all times. Wear a triple-layer medical mask appropriately when in the same room with the patient. The front of the mask should not be touched or handled during use. If the mask gets wet or dirty with secretions, it must be changed immediately. Untie it from behind and wash your hands thoroughly after disposal of the mask. Disinfect the mask before disposing of in a closed dustbin. Ensure hand hygiene after coming in contact with the patient or the patient's immediate environment. Use soap and water for washing your hands and wash at least for 40 seconds, or else use alcohol-based sanitizers. Use of disposable paper towels to dry hands is desirable after using soap and water. If not available, use dedicated clean cloth towels and replace them when they become moist or wet. Always wear your mask and disposable gloves while handling the patient directly. Wash your hands before wearing and after removing your gloves. Avoid direct contact with body fluids of the patient, particularly oral or respiratory secretions. Avoid direct exposure to potentially contaminated items in the patient's immediate environment like utensils, used towels, or bed linen. Please make sure you don't come in direct contact with the patient while giving them food. Keep it at a distance. And always use disposable gloves while handling their utensils. Utensils and dishes used by the patient should be cleaned with soap or detergent and water while wearing gloves. Always wash hands after taking off gloves or handling used items. The washed utensils and dishes may be reused. Use triple-layer medical mask and disposable gloves while cleaning or handling surfaces, clothing or linen used by the patient. Segregate the patient's clothes, bed linen, bath and hand towels, and clean them separately using regular laundry soap and water or machine wash at 60 to 90 degrees Celsius, that is 140 to 194 degrees Fahrenheit, with common household detergent and dry them thoroughly under the sun. Clean and disinfect patient's room, bathroom and toilet surfaces at least once daily. Regular household soap or detergent should be used for cleaning, followed by 1% hypochlorite solution. The waste, masks, disposable items, food packets should be disposed of as per CPCB guidelines. The caregiver and all close contacts should self-monitor their health with daily temperature monitoring and report promptly if they develop any symptom suggestive of COVID-19. From the first day of home isolation till the day the patient recovers, please try to ensure that nobody leaves the home. You can request your relatives, friends or neighbors to help you with daily supply of essential items. Please request them to leave these items at your doorstep so that you can avoid direct contact. You can also order these items online and request home delivery. Follow these rules strictly for the safety of yourself and your family. How to self-monitor? Do health checks every morning and every evening or anytime you feel like you might have a fever. In case of dependent patients, caregivers can monitor the temperature, pulse and oxygen saturation levels. Check your pulse rate daily twice for 1 minute. For checking your pulse, place your index, first finger, and middle fingers on the wrist, at the base of the thumb. Using a clock or watch with a second's hand, count the number of beats you feel in a minute, or count them over 30 seconds and multiply the number by 2 to calculate the number of beats per minute. Check your oxygen saturation levels twice daily by using the pulse oximeters. If your body temperature exceeds 100 degrees Fahrenheit, that is 37.8 degrees Celsius, or your pulse rate exceeds 100 beats per minute, or your oxygen saturation dips below 95%, immediately call an ambulance. Be alert for other symptoms of COVID-19 which could indicate that the patient needs medical attention. These symptoms are difficulty in breathing, persistent pain or pressure in the chest, mental confusion or lack of alertness, developing bluish discolorations of lips or face, dip in oxygen saturation, slurred speech or seizures, weakness or numbness in any limb or face. In case of early warning signs or if the symptoms increase, please call an ambulance. Special instructions for neighbors of patients in home isolation. If you have a COVID-19 patient in home isolation in your building, do not worry. Be cautious about a few things to keep yourself and your family safe. Sanitize the common areas of the building like the lift or the stairs 2 times a day with 1% sodium hypochlorite solution, especially frequently touched spots like the railing of the stairs and the lift buttons, etc. This solution should not be used to clean metallic surfaces like door handles, security locks, as it can lead to rusting. Other alcohol-based sanitizers should be used for disinfecting metal surfaces. If someone in the neighborhood is in home isolation, then maintain telephonic communication with them and keep their spirits high. Until their recovery is complete, help them with essential items like medicines, groceries, and ration. These should be kept outside their house to be picked up by them. Transact using digital payments only, or it may be done once the patient recovers. Recovery process and testing. Patients advised to home isolation can end their home isolation after 10 days of onset of symptoms and no fever for last 3 days. Thereafter, the patient will be advised to isolate at home and self-monitor their health for further 7 days. Please follow all instructions strictly and take good care of your health. We look forward to your better health and we are always there to take care of you.
तो अगर आपको कोरोना हो गया है लेकिन कोई सिम्टम्स नहीं है या मामूली से सिम्टम्स हैं, तो आप अपने घर पे रह के अपनी देखभाल कर सकते हैं। इस वीडियो में जो बताया गया है उसका पूरी तरह से पालन करें।